baby aspirin just because we had read that might work. So she's a junior in college at a local, we live in Buffalo, New York, and there's a local college called Niagara University. And she's majoring in social work and minoring in deaf studies and ALS. ASL, sorry, different disease. I do that all the time, and that's why Linda's here. So we're gonna start off talking about NF2 BioSolutions, and I joined this board soon after they became an organization. So Dr. Nicole Henwood is a picture of her and her son, AJ. Just in 2018, he was diagnosed with NF type 2 and had multiple tumors. And Dr. Henwood is a graduate of Cornell Medical School and had experience at the Pennsylvania Institute of Human Gene Therapy doing some research when she was in college. And she right away started reading everything she could about NF2 and was shocked to see that no one was really looking for novel therapies, meaning gene therapy, immunotherapy, bacterial therapy, things like that, that everything was drug therapy. So she said that it's unacceptable. So she decided to start her own organization, and she called it NF2 BioSolutions. So why was there a need for this organization? First of all, at the time, there was no, and there still is only the one, there is no NF2 specific advocacy groups out there. There was one several years ago called NF2 Editor. Linda and I both served on the board of that organization as well. They dissolved a few years ago, and their mission was a lot different than this one. So as Nicole talked to gene therapists and stuff, they really encouraged her to have a single disease specific organization, because advocacy is really the key. Is someone has to go out and find these researchers and tell them what NF2 is, and no one was really doing that in the gene therapy world. Medications and surgeries have side effects and do not cure NF2, so that was another reason that we felt we needed novel therapies. And there was no organization focusing solely on gene therapy. Rare disorders are getting a lot of attention by biotechs and pharmaceuticals. So the timing of NF2 gene therapy had never been better. Linda and I have been to a couple conferences for an organization called Global Genes, and that is definitely something that resonates, is that rare disorders are big right now. The reason being that a biotech can put only a few $1 million into a condition that's small and practice and test their platforms for gene therapy and immunotherapy. And if they work, then they can move on to something that's a larger thing, like a form of cancer. So rare diseases are big, which is good for NF. So what is our mission? Our mission really is to find a cure. That we envision a world where those diagnosed with NF have a treatment through gene therapy or immunotherapy that actually cures them. And they can go through life fully productive, free of pain, without fear of losing their senses, mobility. I think that's the goal of every family that has someone with NF2. So Nicole started by forming a board of directors, and I serve on the board. And as you can see here, that everyone on the board is either a spouse or a parent of someone with NF2. You may know some of these people. It's also an international board. So our vice president is Gilles Atlan, and Gilles is a software engineer, and he lives in Israel right now. He's brilliant. Our treasurer is Dion Owen. He lives in South Wales. His wife has NF2. And then a lot of these other people you may know. Vito Grasso's daughter, Becky, has NF2, and Jill Velez's daughter, and Chantal Nobis has a husband and a daughter with NF2, and Amy Williams has a daughter. And there's other people on the board as well. Sorry, Amy has a son. There's other people on the board as well that I haven't listed everybody. So we have a volunteer chief scientific officer, and his name is Edgar Rodriguez Lebron, and he is a legend in gene therapy, and he is totally volunteer. He came to our gene therapy for NF2 consortium we had a year and a half ago, and he was just totally impressed by our organization and by the commitment of the parents and spouses, and he wanted to be part of it. So he has been chief financial officer for several major pharmaceutical companies, and he's patented several vector designs for research, and he is incredibly highly respectable. So what he does is he helps to drive our science mission, and he helps guide us as to how to navigate the minefield of science and gene therapy, and it truly is a minefield. So we have a scientific advisory board, and we're always building this board. And you can go on our website, and there's more people than this, but I just wanted to name a couple here. Some of you may know Caleb Yohe. So Caleb is an NF2 specialist. Dr. Michael Calamares is out of Paris, and he is brilliant and does a lot of incredibly groundbreaking stuff. BioSolutions actually just funded him. He's designing NF2 mice for ependymoma, and that's something that no one has. It's a 2-year project. It's important. It will allow us to test our gene therapy vectors on ependymoma mice as well as meningiomas and schwannomas. A couple other big names here: Dr. Brad Welling out of MGH. He's a legend. William Slattery out of House Clinic. Just some really big names in NF2. Then I want to introduce you to Kriselle. So Kriselle is awesome. Kriselle is a NF2 researcher from the Philippines, and she has NF2 herself, diagnosed several years ago, and she's hearing impaired and other issues with her NF2. And she wanted to work on NF2 and not cancer research. She was doing a lot of cancer research in the Philippines, and NF2 BioSolutions got her to come to the United States, and she was hired at Nationwide Children's Hospital in the NF2 program that NF2 BioSolutions started there about 1.5 years ago. And I think she's been working there about a year now. So she's got the pleasure of trying to cure her own disease, which I think is remarkable. She is a beautiful and remarkable young lady. So Linda's going to explain why gene therapy seems to lend itself to NF2.
So the biggest reason is that it's a single gene disorder. It's on the 22nd chromosome. And as he said about Dr. Rodriguez, is that there's a lot known about the adeno-associated virus, and that lends itself to a target to deliver the genes into someone to hopefully fix NF2. It starts in pediatrics for most people. Not everyone gets diagnosed in the pediatrics, so it's detected early on. The natural history is done. We know what happens if you don't do something about NF2. So the outcome, while different progression and some people have different severities of it, but we know what the outcome is. It's also an incredibly expensive disease. And so if we can fix it and fix it early on and avoid all these surgeries and missed work and time in the hospitals and chemotherapies that are incredibly expensive. And lastly, it's a slow growing tumor. And that really does lend itself to gene therapy, because the difference in cancer is that they're fast growing cells. The cells are replicating very, very quickly. And there's a sudden change where in NF, it's a very slow, and there's a transition and a progression.
So what are some of the challenges that NF2 BioSolutions has trying to advocate for a cure? So there's a need for a constant, proactive patient and parent base. And we've decided to go globally with this because it's a rare disorder and there's few in numbers. So we work and network globally through different ambassador programs. We need to build trust and legitimacy. So it's really important that everything we do, that we are honest and we do everything correctly. And we have lawyers that work pro bono for us and things of that nature. So we try to do everything very legitimacy, because building that trust is super important in the medical field. And lastly, we need to expose gene therapy successes and why NF2 is a good candidate. And because most gene therapists and most immunotherapists have never heard of NF2. So that's kind of our job as an organization, is to advocate. So what is our strategy? So we call ourselves NBS, by the way. That's NF2 BioSolutions. So NBS, our goal is to find, support, and fund research interested in working on gene therapy for this condition. Connect these researchers to NF2 specialists who can assist with tissue banks, small and large animal models, and natural history studies. So what we've learned is that gene therapists, the first thing they ask is, are there animal models? Are there small animal models? Are there large animal models? How many natural history studies have been done? Do we have access to them? Are there tissue banks? So the answer to most of that is yes, 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 that we already have incredible stuff done in the NF2 world. So we as an organization have to link the appropriate NF2 researcher with the gene or immunotherapy researcher. And we'll talk about how we did that in a little bit. We want to support and fund the most promising NF2 gene therapy programs and really push them into clinical trials by finding biotech companies and fund the project, or find a major donor to fund the project. So we've raised over $1 million in about a year and a half, just under that. And we're very proud of that. We fundraise very well. We are very good at getting large donors. We just recently got a $250,000 donation from a company. And we use that money to start seed programs, which we'll talk about, Linda will talk about in a little bit. And then we work with biotechs to try to get them interested in these seed programs we have, because we know that to take all of our different programs to clinical trial will cost millions and millions of dollars. And we're not gonna be able to fundraise that much. Each program would cost millions of dollars. So we are connecting biotechs with the researchers. Whenever possible in our contracts with these researchers, we try to negotiate a percentage of the ownership of the intellectual property of these projects. And this money can be then used to assist in patient costs when these therapies will eventually be available, because we don't know the end game of will insurance companies pay for it and all of those questions that's probably going through your mind. We don't know the answers to those yet, but we want to have a fund set up that we can assist with that. And we're working on that as well. And we'll continue to work with biotechs and researchers, even beyond clinical trials, to continue to advocate for NF2 patients. So that's a lot of work. So how do we start? So back in March 29th of 2019, we had the first ever gene therapy for NF2 consortium. And it was kind of by accident. We wanted to do it. And then we saw that in Boston, 3 days prior, there was a gene therapy for rare disorders conference, and people were coming from all over the world, from different biotechs and research institutions, to talk about rare disorders and gene therapy. So we just started cold emailing a bunch of these world-renowned researchers and asking them if they'd stay an extra day if we pay their hotel and feed them. You always have to feed them. And if we would pay for their hotel and feed them, would they stay an extra day? And would they meet with people from the NF2 world, and so we could have a discussion and kind of like a workshop on this? And a whole bunch of them did. So then we said, well, we can't just have the gene therapy researchers there. We need NF2 people. So we reached out to all the leading people in NF2 clinical care, NF2 surgeons, and NF2 research. And we invited all of them. Most of them were able to come. Some had other things going on and couldn't. And we were able to get a room in Boston, and we're going to talk about that next. So this is what the room looked like. And we had this combination. In each table, there was gene therapy researchers, NF2 NF2 surgeons, and NF2 researchers. So we intermix them all together, so none of them sit with their friends. So I'm a teacher, and we know you don't want that, because they just talk the whole time. So this is a video, and this is just going to play for a little less than 2 minutes. And this is going to show this process that we did. We basically gave them questions to work with, and they talked at their table, and then we debriefed at the end of each section, and then we gathered all of this data for our next steps. We will not talk during this because it
John, we're not seeing the video.
Worried about that transition. So we did transition. So the day was just energy packed. Linda and I were very emotional just to see. We had been to symposiums for 15 years, you know, and we met a lot of these NF2 researchers, and to see them all in a room together. Dr. Evans flew in from England, from the UK, he keeps correcting me, Wales, and just amazing that these people all came. Dr. Brackman, a lot of you have heard of him. He is an absolute legend in NF2 surgery for vesicular schwannomas. He flew in at age 80 from Los Angeles and was like a kid in a candy store and was just amazed at all the energy in this room. So it was really cool. So Lynn's going to talk a little bit about just the bare bones basics of gene therapy.
Okay, so gene therapy essentially is the addition of new genes into a patient to either replace missing genes, manage the malfunction either by adding, replacing. There's all sorts of different lingo. And it's typically done using a vector. In this case, we're talking about the adeno-associated vector, and that carries the therapeutic gene into the cell. So when we say it's a virus, we're using the way viruses get in and can invade us, but they don't take any illness in. In this hope, we're helping to use them to transport in the gene therapy to fix the problem. And the reason NF2 is a good candidate is, again, it's a small gene compared to other genes that tend to be larger, and it's a single gene disorder.
So these are the 4 programs that NF2 BioSolutions has started in the last year and a half. And most of this came from that conference you saw, that consortium. And I'm gonna have Linda talk in depth about these because I don't understand what any of these people do, but they're brilliant. So the first one is Dr. Brenner out of Massachusetts General Hospital. And he actually was one of the first people looking at gene therapy for prior to even BioSolutions being an organization. This is Dr. Flote. He is the Dean of the Medical School and the Gene Therapy Center at University of Massachusetts. Catherine Meyer, she is at Nationwide Children's Hospital. And they have, both of those programs have started a gene therapy program for NF2 and have really, they're showing incredible progress, both funded by NF2 BioSolutions. And then we have John Mechlanos, which I say wrong every time. Mechlanos. He's a great guy. And him and Dr. Brenner, back to Dr. Brenner in the first slide there, are looking at using bacteria to actually kill NF2. And their early results are absolutely amazing. And I'll give you some exciting news about them in a little bit. So Linda's going to kind of just briefly break down each of these programs for you.
So Dr. Brenner's lab does basically the suicide gene approach, which is using the vector to go into the gene and killing the tumor cells, essentially. So it will shrink the existing tumor and kill it off. He's focusing essentially on schwannomas. And again, early on in the research, do we know that schwannomas and meningiomas and ependymomas will react the same way? We don't, but you have to, as Dr. Welling said, you got to try something and start somewhere. So we're starting with schwannomas with the suicide gene approach in that lab. And then they're working on the IND approval before moving on to the FDA. Dr. Mueller, who now has just actually recently left the lab, but at the time he was at this gene therapy consortium that we did. And he's like, oh my gosh, what I'm doing in my lab for adeno-associated virus and gene therapy, I think we can totally apply to NF2, and kind of went right back to his lab. And that was the wonder of that day, is that there was a lot of, as Dr. Brenner talks about, silos of research being done either in gene therapy and NF2, and was bringing them together to kind of say, what can we use to share that knowledge and try and fix this? And so Dr. Mueller works on the gene replacement, where you use that vector to go in and silence or replace the quote unquote bad part and fix the NF2 gene that way. And so you create a functioning NF2 gene so that tumors won't grow. So it's going to stop tumor growth. And then the next one is Dr. Meyer's lab, and she's working on the gene addition approach, where again, you use that vector to bring the gene in, and you're adding the functioning gene to again halt tumor growth. And it's the intricacies, these are all for gene therapies to understand, but to understand is that there's a lot of things we've learned about gene therapy over the years, but we now need to apply what's been learned to NF2 and then the specific tumors that you're dealing with in NF2. So Dr. Meyer works at Nationwide Children's Hospital, and that's also where Kriselle's working on that one. And then lastly, you've got bacterial therapy, which is a little bit different. In terms of gene therapy, you're using a virus to get the gene in there to fix the situation. Bacterial therapy is using bacteria to actually destroy tumors. So it's been utilized in certain cancers. I think bladder cancer is probably where it's most recognized. But can we now, and that's what Dr. Machalanos is working on with Dr. Brenner, use some genetically modified bacteria to kill actual NF2 tumors. So again, if we stop the tumors from growing, we stop their devastating effects. And that really is the goal of all of this. The results on the mice have been very, very positive. We all know sometimes what happens in mice doesn't always move over to humans, but sometimes it does. And again, we need to start somewhere. So all of this research, the initial research, has now been supported and funded by NF2 BioSolutions.
So some really exciting news. Just last week, Dr. Machalanos and Dr. Brenner received a $650,000 grant from the National Institutes of Health. And this grant was, we helped write, for them. And the beauty of this grant is it has an option of multiple millions of dollars at the back end. So they'll take this $650,000 and it'll extensively research this bacteria that they're using. It's a genetically modified bacteria. Unfortunately, I can't tell you what the bacteria is, but so if it shows progress, then NIH will continue to fund multiple millions of dollars and they'll take it all the way to human trials. So this is something that we invested a couple $100,000 in, and we now do not have to fund this at all. That NIH now can take this all the way to the end, which is super exciting and can allow NF2 BioSolutions to focus on some other programs that we have. And it's kind of like a race for the cure. We don't know which one's going to work, so we need to have a lot of eggs in one basket. So some other gene therapy programs that are out there, because it's not all supported by NF2 BioSolutions. So this is one called NF2 Therapeutics. I don't know that much about it, but from what I know is they've received 2 grants from the Children's Tumor Foundation, and their research is being done mainly in Germany by Dr. Morrison at the Fritz Lippmann Institute. He's a gene therapist. Michael Wooten is their CEO. I've heard him present a couple times at webinars. And Scott Plotkin, very well known, the legend, is their scientific advisor. And this is a spin-off organization of NF2 and Therapeutics, which is the organization or biotech that is marketing and selling the MEK inhibitor for NF type 1. So they are very well-funded organization. So other gene therapy research right at the UMass lab, they're doing NF1 research, all right? NF1 research for gene therapy. So this lab, Linda and I visited this institution. Their lab is right next door. And Miguel Estepes is a PhD researcher there. He received a $12 million grant from the Gilbert Foundation to research NF1 gene therapy. This is him in the picture on the left, and to his right during one of our visits, that's Kim Bischoff, the executive director of NF Network, Lori Ryan, who's the president of the board of NF Northeast, and Karen Peluso, who is the executive director of NF Northeast. NF2 BioSolutions is also working for an open access NF2 Biobank, and this is the first ever biobank. This will be open to any researcher, gene therapy, drug researcher, it doesn't matter. And they will be collecting biospecimens. And we're having a webinar on October 24th at 11 a.m. So look for that on social media to learn more about this. We also have webinars on our website on gene therapy and the bacterial therapy program. So we believe in collaborative funding. So the entire UMass program was funded in collaboration by 3 organizations, NF Midwest, NF2 BioSolutions, and NF Northeast. And now the nationwide program and the UMass program have both manufactured their vectors. And we're looking at a collaborative model with probably 5 or 6 different NF organizations to do work at Wade Clapp's lab in Indiana, where he is now going to test those vectors on NF2 mutated mice.
So to kind of back up a little bit too, I think the best way to think of gene therapy, if we're talking about gene therapy, is that genes are letters, and those letters come together to make words, which is what DNA basically is. And then the chromosome is the books. And so in gene therapy, you're trying to correct the letters so that it spells the right word. For medications and genes and all that, you need phases of trials. And this is just a quick thing of phase 0 is you start real small and you give a little bit of drug and see if it makes a difference to a few people. Phase 1, find the best dose. Phase 2, how safe is it? Phase 3, start to compare it to the standard of care. If you think this drug is going to work specifically for this situation, does it do a better job? And then lastly is phase 4, give it to a whole bunch of people and see how it works. So to understand that now, we have to understand the 2 other things that are going on in NF2 trials. So basket and platform trials are the newest forms of trials in research. So a basket trial, think of putting all of your eggs in one basket. The eligibility for NF2 now is specific for a genomic alteration. So NF2 fits into that. There's multiple tumor types that you can see the effects of these medications that you're trying. So NF2 hits that basket as well. There's schwannomas, meningiomas, and ependymomas. And last, the trial that we're about to talk about is in a phase 2 screening trial. So these are drugs that already exist and they may work for NF2, but they've never been labeled for NF2 use. So we're going to put all of our eggs in one basket and compare it. The platform trial is kind of a form of an umbrella trial. If you think an umbrella trial, you get a big umbrella, and let's put one big trial in under that umbrella. So you have the same eligibility criteria for everyone involved. There's multiple interventions evaluated simultaneously. What makes it a platform trial is that it's perpetual. If one drug doesn't work, or maybe it doesn't work for that specific tumor that's growing, let's pull you out, clean you out, try you with another drug, same eligibility, and see if that works. And so I tell people, think of a platform trial as a whole bunch of trains. If you're trying to take a train from Buffalo to New York and you miss it, there might be a one later on that might fit your schedule better and still get you to the same location, which in our situation is, let's stop these tumors from growing. So the INTUIT is the innovative trial for understanding the impact of targeted therapies in NF2. The principal investigator is, again, Dr. Scott Plotkin with Takeda and CTF. And it's a multi-arm phase 2 platform basket trial. So that's why we had to get a little bit of knowledge there to understand what that means. The master study is a basket. We've put all of our eggs in one basket, and those enrolled will have multiple tumor types. They're going to receive new drugs throughout. So embedded in it is a platform trial. They're going to start with brigatinib. And if that doesn't seem to be working, we're hoping now with the same eligibility to get other drugs in there. The goal is to have 80 participants over 10 years, and it's openly enrolling now. Go to clinicaltrials.gov, put in neurofibromatosis type 2, and go from there. It's right now starting at Mass General, but they're hoping to have it open in a few other locations as well. The other study that's going on, also found at clinicaltrials.gov, is the natural history study of patients with NF2. And this is an ongoing one by the National Institute of Neurological Disorders. The chief MD there is Dr. Chittabonia, and Gretchen Scott would be your contact person. And basically, we know what happens if you don't treat NF2. And this is now looking more specifically for people to look at some issues with speech and swallowing and peripheral neuropathy, but also some of the issues is some biomarkers on imaging for hearing loss and biomarkers for disease progression. So wouldn't it be wonderful if someone's getting diagnosed to be able to say, this is what we think we foresee, and if hearing's going to be an issue sooner rather than later, or this tumor is going to be an issue sooner rather than later, now let's do this surgery, or will we have gene therapy and or medications in the future? So it's an exciting time. Leah was a part of the study when she was first diagnosed. And at that time, surgery was the only option. There weren't even medications. Avastin was still just moving along. So it's an incredibly wonderful, supportive institution financed by our tax money. And when you get there, you're surrounded by people with a wealth of knowledge and are familiar with NF2. And I think that is a wonderful, supportive thing to hear from many people with NF2, because they often have people that they've interacted with that aren't always familiar.
So Linda and I are also presenting a presentation on service dogs for the NF community. That started 2 minutes ago, but they can't.
Actually, John, you've got about 8 minutes before that next one starts.
Awesome. So if you want to take questions, Bree will read them to us, and we're happy to answer any questions you have.
Yeah, we've got just a few more minutes here. Thank you so much, John and Linda, for putting this presentation together. It's really exciting research that's being done, and we're really excited for the future of NF2. Let's see here. Wait a couple of minutes here. If anyone's got questions, please be sure to use that Q&A box at the bottom of your screen.
We also have our contact information here, and you're welcome to call us or email us with questions if you think of them later. We're fine with that.
Awesome. I do have one here. It says, are any of the gene therapy vectors already being tested on human patients, and are there any success stories?
So none for NF2. That is way down the road. They're just being tested in cells right now, and the next step will be testing them on mice. But it has been approved, and there's things for multiple forms of cancer, and I don't know if
Sickle cell is probably
cell.
the biggest thing that's been in the news lately. So again, we're still in the stage of learning how to do this and how to apply it to NF2, but just getting people at the table to talk about it is the beginning.
John and Linda, you mentioned, or in one of your slides, about big models, animal models. Are we looking at swine or some other kind of model, or what models were you referring to?
Yeah, that's a great question, Sharon. So that's still undecided. There definitely is in the process right now. There's several institutions that are in the process of creating NF2 swine pigs. And some are being successful, and some are still struggling with it. It's a hard thing to do. The NF Network went through funding with multiple organizations at University of Wisconsin at Madison, and they have an incredible swine pig program there for NF1. But there's talk about non-human primates as well, and which is, you know, again, very controversial at times. So it is undecided. We're going to let the researchers kind of tell us what they think the next step will be after the mice. And then we'll start looking into that. That would be a couple years down the road. Good question.
Okay, great. The other thing I was going to mention is I think both of you are, and NF2 BioSolutions is such a powerful example of how parents can channel their passion into something that is so much bigger than their own case and their own family. I mean, it's really amazing what you all have done, and I commend you for putting all your efforts and your energy together and what it has produced. It's really quite remarkable.
Well, I think it just speaks to what NF2 is. You know, obviously we didn't plan for it to happen in our lives, but it does. And what are you going to do with it? You got to make lemonade out of your lemons. And if someone would have told us 2 years ago, we would know what we do about gene therapy and be even talking about it. And when the very first symposium we went to, I asked a researcher, I'm like, can't they just replace that? And who'd have thought that I would never have envisioned that we would be talking the way we are, but it just really is coming together with the research that's been done way before us.
Very exciting, very exciting. And my last question is, well, it looks like you have some other questions, so I'll let you answer some of the other questions.
Yeah, it looks like we're actually running a little short on time here, so I will make sure to save these questions and get them over to you both, John and Linda. We are going to take this time and switch over to our use of service dogs in NF that is also going to be led by John and Linda. So we hope to see you over there. And once again, thank you so much for sharing in this presentation with us today.
Thank you.
All right.